Hey guys, it's Mona Entezari here, physician assistant at Yag-Howard Cosmetic Dermatology. I wanted to talk to you about dental procedures. Dental procedures, especially invasive ones, can create inflammation, they can disturb the anatomy, they can increase the risk of infection, and they could possibly lead to filler migration. Invasive procedures such as root canals or extractions or implants. Or even lighter procedures such as dental cleanings. These could release bacteria, which go into your bloodstream or back up your lymphatic flow and can lead to biofilm formation. Not to mention the swelling and inflammation that can alter the facial contours and kind of disturb accurate placement of what we do, which is fillers. Lymphatic flow disruption affects how injectables can settle, so that can lead to prolonged edema or swelling after an injection as well. And like I said, even routine cleanings can expel bacteria, which is what we don't want near your procedures. So, what we're asking you to do is to avoid coming in for any sort of injectable procedure, such as filler or biostimulator, for at least 2 weeks before and at least 2 weeks after your visit to the dentist. We want to make sure that there's no inflammation. We want to make sure that there's no infection. Typically, there isn't an issue, right? Your immune system does the work for us without you even knowing. But I don't want your immune system to recognize my filler because it's revved up and ready to go to take care of all the bacteria in your mouth. Another thing that we do to ensure that we lower your risk as much as possible is we actually give you mouthwash just before we do any sort of filler around the mouth. It's for the same reason. It's to avoid biofilm formation, which what does that mean? Biofilm that forms, it happens later. It doesn't happen immediately. It can take a minimum of 2 weeks to see any adverse events happen. And those adverse events mean a hardening or a swelling of the area injected. It could even be swelling of areas injected years and years ago, just because your immune system is revved up and ready to go and recognizing what we placed there or somebody else placed there a while back. So let's avoid this. Let's minimize that risk and let's avoid making appointments for your cosmetic procedures for at least 2 weeks before and 2 weeks after. Even for toxin, I want you to wait at least a couple days for that, and I actually want you to wait at least 5 to 7 days for any laser resurfacing, for any microneedling. Again, it goes back to a compromised immune system. Light facials, BVL, soft wave, I'm not quite as concerned because there's no break in the skin and we're not looking for any specific anatomical features. So those seem to be okay. But still, if you want to err on the side of caution, wait a couple weeks and we'll take care of you.